How would you like to be told you have a pulled muscle only to learn later it is something far more serious? Well, that is happening to some teen athletes. KVU's Jim Bergamo is here with the telltale signs of the real injury causing the problem. Jim?
Well, hi there, Tyler. Orthopedic surgeons say what can be passed off as pulled hip muscles in teens may actually be something called hip impingement, and without surgery could end up leading to arthritis later in life. These are photos of Alex Kotlars in action on the football field for Southwestern University in Georgetown. But as late as a year ago, he knew something wasn't right.
All started with even just getting in my stance. I could never get in a proper stance before because my hips, they wouldn't let me.
That's a big deal when you're an outside linebacker.
It was just while I was squatting, I felt a sharp pinching in both my hips, really.
Like most teens, Alex thought a little ice and rest could fix it. When it didn't, his team trainer suggested he see orthopedic surgeon John McDonald at Texas Orthopedics. He explained Alex was suffering from hip impingement, a common yet frequently missed ailment in teens.
What happens during their peak growth years is that growth plate and the ball part of the ball and socket joint sees stress because of twisting injuries.
McDonald says that results in excess bone in almost a convex formation along the femur near the socket.
So that decreases the space between these two bones, so when he comes up into certain positions, those bones pinch.
Arthroscopic surgery removes the excess bone.
So we've seen that here. We've created this concavity here that matches his other side. So now when he comes up into certain positions, that bone does not hit that bone anymore. Relax and hold that up strong. Excellent.
Alex admits he didn't even know what hip impingement was, but he sure knows how good he feels now.
So I would learn what it was like to have, normal mobility in my hips, which, I'd learned that I never really had before because of the hip impingement. It wasn't long after the surgery that I could already move my hip in places that I never had before, in my whole life.
Studies show teens who suffer from hip impingement are more likely to suffer from arthritis later in life. Dr. McDonald says while research results are still in the early stages, correcting hip impingement properly as a teen should help reduce that risk of arthritis. Jim Bergamo, KVUE News.